interactive platform where experienced professionals and subject matter experts are hosted to provide insights, knowledge, and information for all to thrive. So we'll go through the housekeeping rules very quickly. Please ensure you're muted when you're not speaking. We will take questions and interactions during the Q&A session. You'll be notified. You may please drop questions and reactions in the chat box or raise your hand to be unmuted so you could ask your questions. Once again, if you're not speaking, kindly ensure that you're muted to enable us to have a rich and wonderful experience. Thank you very much. So today we will be discussing thriving in a crisis, addressing mental health, psychological and psychosocial needs, I beg your pardon. And this conversation is very important for me, especially because I'm an advocate for mental wellness. And according to the World Health Organization, the pandemic as rapidly sweeps the world, it is inducing different issues, mental health issues. We're talking about worry, fear, depression. And the UN has warned us of a global mental health crisis due to the COVID-19 pandemic, which is why we are having this very important conversation. Today we have two health professionals who have been gracious enough to join us, Dr. Oge, a family physician, and Mrs. Olamoyewa, a licensed clinical psychologist. They will be sharing insights on this very important topic. Very shortly, you would see a poll will appear on your screen. Please take the most appropriate answer. It's for us to actually find out how you knew about the webinar, your age bracket, your gender as well. We want to find out if you're a customer of the bank or you're a friend of the bank. We want to find out how this pandemic has affected your mood or your mental health. We also want to just find out and share with the professionals if you've experienced any of this. So we're talking depression, suicide, anxiety, and sadness, and the whole bunch of others there. And we also want to find out from you if you think the mental health is a relevant discussion and it is worth discussing. Please note this poll is actually 100% anonymous, so we don't know who is sharing. We just want information on how to support you to thrive better. Thank you very much. So we'll just give like a minute to allow participants to take the poll questions. Thank you very much. It would be great if we could quickly do it. So we actually at about 8%. So only 8% of us have actually voted. So can we just quickly run through it so we can start the session proper? Because we're actually hoping for this to be very interactive. We want it to be a workshop, so we have enough time for the professionals to take your live questions. And we can only do that if we can quickly go through the poll questions. So we'll just give a minute for that. Thank you. Thank you. We're at 40% right now. So thank you so much for taking the poll. Like I said, it's anonymous, 100% anonymous. We just want to know how to support you better. So has the COVID-19 affected your mental health? Yes, it has. No, I'm not sure. And have you experienced any of this? Depression, suicide, anxiety, stress, fear, burnout? Okay, so now we're about 45%. Thank you so much. We just wait, maybe when we get to about 80%, then we can deactivate the poll. In the meantime, please follow Accion Microfinance Bank on all social media platforms and Accion MFB for upcoming episodes and for more information about the bank's products and services. Thank you. So we're just waiting for the rest of the team to take the poll questions. Thank you. Okay, great. So I think we can continue at this moment. Okay, like I said earlier on, we have two professionals in the house this morning that would be supporting us. We have Dr. Oge Ilegune. I hope I got the pronunciation right, Dr. Oge. Is that fine?
It's
great.
Fine.
All right, great. Because I usually call you Dr. Oge. I don't think I've actually called you, officially called you your last name. Yes, I wanted to be sure.
Yes, you got it right. You did.
Great. All right. She's a family physician at Dennis Ashley Medical Clinic and Lakeshore Cancer Center. She's also the head of strategy, development, and outreach at Lakeshore. Dr. Oge is a graduate of the University of Nigeria Medical School in Enugu, class of 1996. She left for the United States in 2000 and went on to complete a residency in general practice, becoming a qualified general practitioner and an associate member of the Royal College of General Practitioners in the UK. She practiced as a general practitioner for 8 years in primary care, where prevention is an integral part of the healthcare management. In September 2014, Dr. Ilegun Nigeria has continued her work in general practice, focusing on cancer screening, non-communicable disease screening, and preventive measures. She's focused on good delivery of health involving educating patients on how to look at their health holistically and to offer patient-centered care with cost-effective methods which do not detract from the quality of care. Her current role includes Director of Clinical Services and Principal Clinician, I beg your pardon, for Dennis Ashley Clinic, a primary care clinic where she is keenly focused on spearheading the management and eradication of non-communicable diseases in Nigeria. She is the head of strategy, development, and outreach at the Lakeshore Cancer Center with a key interest in cancer screening. In her role, she has created many strategies for increasing the cancer screening awareness amongst individuals and corporate establishments. She has recently completed a certificate program in healthcare management at the Lagos Business School. Management strategy also become an increasing part of her practice. Mrs. Busola Olamuyiwa. She's a licensed clinical psychologist, director of Unforsaken House of Esheba Psychological Services and a clinical psychology. Busola Olamuyiwa, MSc Applied Psychology, BA Honors in Psychology, Diploma in Cognitive Behavioral Therapy, British Psychological Society, verified test user, occupational and personality, and she's the director of Unforsaken House of Esheba. Busola received her MSc in Applied Psychology and BSc in Psychology from Dublin Business School of Psychology, specializing in clinical and organizational psychology. She has 10 years experience as a consultant, researcher, and psychologist within Ireland and Nigeria. A member of the Psychological Society of Ireland, the Nigerian Association of Clinical Psychology, and qualified as a registered British Psychological Society. Wow, what a bio. Thank you so much, Dr. Oge and Mrs. Olamuyiwa for joining us this morning.
Thank you for having us. Thank you.
Thank you very much.
Thank you. So I think we'll just dive right into it very quickly. So like I mentioned earlier, WHO has said that as the corona pandemic rapidly sweeps across the world, it's inducing a considerable degree of fear and worry. It has warned of, health, a mental health crisis. It's really ideal for us to begin to understand what mental health issues are and how the effect of the pandemic, the effect of the pandemic on our health generally and mental health, because a lot of conversations have always been around, the effect of the pandemic on business, on physical health, not on mental health itself. And I think it's important that we have that discussion. So Dr. Oge, do you want to share your thoughts on that?
All right, thank you so much, Hadefisayo, and to your company, Accion, for having us here today. It's quite interesting that you've selected this topic, and for me, I think that reflects on, the culture you have in your company, because you just mentioned that it's not just the impact on finance. And based on that, looking at the topic, thriving in a crisis, addressing mental health, psychological and psychosocial needs, there are two things I think we should sort of concentrate on here. So one is, what is a crisis? And a crisis is a time of intense difficulty or danger. When we sort of use the word crisis, we don't often sort of pause to think of the ramification of that word. It's intense, it's difficult for the person or the people undergoing that crisis. Then the other thing you mentioned was the fact that the WHO, as usual, the World Health Organization, is concerned about the pandemic, it's concerned about the health impact. And that's also because WHO has formed a sort of holistic approach when it comes to looking at health of people. So most of us might look at our health in silos. I'm well, I feel physically well, because I feel, emotionally stable. But everything is interconnected. And when we look at the definition, there are actually several elements of health. So of good health and well-being. So you have the physical, you have the mental, you have the emotional, you have the social, you have the financial, you have the spiritual. And to be honest, you're not exactly 100% well if one part of that, that list is not actually balanced. So when we're thinking of this pandemic right now, this coronavirus, we're all concerned about, sort of getting the infection, or we're concerned about the impact on our businesses and our livelihood. But actually, all the other things are are all tied in. So when people start worrying about their finance, they obviously become unwell because they are stressed. When people think about their the fact that they are socially isolated, this lockdown has been very strange indeed. You can't hug people, you can't see people. So all those elements begin to tie in together. And that's why I think, the topic is very, very relevant. Because even though we're sort of thinking of the mental health, I think as we go along, we're going to see the interconnectivity of all the different things. And the fact that, to be honest, most people that I've been speaking to, consulting with over this period, have been psychosomatizing. In other words, they are very well, but the anxiety levels have led to them thinking they are unwell with some symptoms of COVID, but they've not been exposed at all. So, it will be interesting to hear from the audience what they have been going through. So I must thank you again for this topic. I think, perspective, I think it's a relevant one, and we shouldn't overlook some of the interconnectivity that comes with it. Thank you.
Thank you very much, Dr. Oge. Before I get Mr. Lamuyiwa's reaction, I'd like to take a few seconds to just quickly recognize my MD CEO, Accion Microfinance Bank, Mr. Taiwo Joda. He has actually joined online as well. So welcome, MD. So we'll take Mrs. Alamuyiwa's reaction.
Good morning, everyone. Thank you so much for having me. I feel very honored to be here discussing a topic that is that I'm very passionate about. So again, I'm Bisola Olamuyiwa, as you have rightly said. I'm a clinical psychologist. For us as clinical psychologists, we're interested in human behavior, why people behave the way they do, why people think the way they think, And so for us, basically, we tend to focus on, the mind, of the person and other social status of the individual that makes them to become who they are. So we don't deal with things in isolation. As you rightly said, mental health refers to a state of well-being when an individual can think rationally, can cope with life's challenges or stressors, and can successfully impact their environment. So if mental health is, an individual's ability to think rationally. This all has to do with the person, you know, and they're not just that, impacting their environment. It has to do with the environment as well. Definitely, we can't look at mental health just from a biomedical approach. We need to look at it in terms of an holistic approach, which is why the topic for today is thriving in crisis, addressing psychosocial needs. So we need to look at this from a holistic approach, like Dr. Oge has rightly said, and taking into consideration the psychological effects of mental health on an individual, but not just that, the social impacts of mental health on an individual. Why biopsychosocial model? I think often, and most people will agree with me, we have all focused on the biomedical side, you know, of health. And according to the WHO, even in defining health itself, it is holistic. It is physical, it is mental, it is social, and it is not merely in the absence of disease. So therefore, psychology is important, social environment is important, and I'm so glad that we have the opportunity to discuss this from an holistic point of view. I look forward to taking questions from the audience as well and seeing where they are in terms of their mental health, how they understand it, and hopefully providing some coping mechanisms from a psychosocial point of view. Thank you.
Thank you so much, Mrs. Alamuyiwa. So I think, I think I want us to dissect the topic, you know. So,
Okay.
So thriving in a crisis, you know, addressing mental health. What is psychological? What are the psychosocial needs? Like, so what are those needs? Let's bring them, you know, let's bring them in from the broad topic. What are those needs exactly?
Is that to Dr. Oge or to myself?
No, that's for you, Mrs. Alamuyiwa.
Okay, great. Okay, so that obviously we've identified a lot of psychosocial needs, but first of all, I think we need to start off by understanding what mental health is, and then go into the different parts of it. So it means, like I already said, to be able to be productive daily, to maintain and manage relationships, and to cope with demands and stressful situations. Now, on the other side, that means you have a good mental health if you can do this actively. On the other side of the scale is then mental illness. What is mental illness? It is, this occurs when there is a distortion to the normal brain activity. And mental illness basically affects the way we think, the way we feel, and the way we behave. And obviously, most of us know some types. I'll just give you some types of mental illness that we have. You have depression, you have anxiety. Most of these are on a spectrum. They range from mild to severe. You have bipolar disorder. I mean, we've all seen the Kanye West video recently, how he went through. And then you have schizophrenia. You have different types of mental illness that an individual can go through. But they, you know, so you and I, we would see the mental illness, we'll see the depression, we'll see the behavior, but there are psychosocial issues such as personality disorder, such as, you know, like Dr. Oge said at the start, financial issues, social issues, work relationship, you know, difficulty, not having even enough social support, you know, is enough. For example, I remember when the pandemic started, and shortly before then, my house help had left, you know, and I was by myself, but I still had to work. I still had my family. I still have to cater to my children, as well as faith and other personal things that I have going on for myself. And now have lost one person that would normally help me, especially with my children. So what does that do to me? Of course, it sort of increased my stress level, and I had to find ways to cope with it. So what did I do? I'll just give you an example. I had to restructure myself, manage my time effectively, come up with a structured timetable that would help me to. So these are issues that once you identify them, you put in direct approach, you know, to tackle it, and from a psychological point of view, and then from a social point of view as well.
Great, Thank you. Thank you very much. So, I mean, I would want us to really discuss support, but I think we'll get into that much
Yes.
later. So, you did mention that, I mean, whoever is active on social media has heard about the Kanye West issue. So,
Yes.
I would like to find out, I think my question is actually two parts. The kinds of mental health challenges that seem to be prevalent in Nigeria amongst Nigerians, and then the role of culture in mental wellness. So those are two parts. So did you get that, or should I take that again?
Yes, I got it. I got it perfectly.
Okay, so I would like to get a reaction from you first, and then from Dr. Ilegune.
Okay, so I think in terms of, I think the most common one would be depression. And like I said, depression is on a spectrum. We have people come into our clinic every day and they say, I'm depressed. I would ask them, do you have a diagnosis? They'll say, no, I just feel like I know because I feel sad. I don't feel good today. But in order to get a diagnosis, in order to say that you're depressed, you need to get a diagnosis. There are certain criteria that an individual has to meet in a DSM to be given a diagnosis of depression. But it's something that is on the forefront. It's something that they've done a lot of advocacy on. So I think depression is very prevalent, but as well as even more serious psychological disorders such as schizophrenia. Bipolar disorder is being reported that in Nigeria alone, we experience about 1.5 million cases. I mean, the people have reported about 1.5 million cases in the year 2019 alone. So schizophrenia is a more serious form of mental illness. It's one that some of the symptoms include hallucinations, psychosis, delusions, and things like that. This is also prevalent, as well as post-traumatic stress disorder, especially for people that have experienced trauma in childhood. We see that is, in fact, I remember when I first moved back and I opened the clinic in Nigeria, I remember calling a doctor friend and saying, trauma, sex abuse, and things like this is actually an epidemic in this country, so we have a lot of post-traumatic stress disorder as well being reported in our clinic. So depression, schizophrenia, and post-traumatic stress disorder, these are the three ones that are prevalent in our clinic. And going by the statistics that we have, this is prevalent in Nigeria. Probably not spoken about enough, but it's quite prevalent.
Very interesting. Do you want to share your reaction or your thoughts on the role that culture plays in mental health and wellness?
Yes, certainly. I think our culture, if we look at things even from the church, and these are areas that I have gone to do a lot of advocacy. Yeah. I'm a faith-based person. I have faith in God. I believe in God. I'm spiritual, but at the same time, I believe in, God giving people wisdom to help us in time of our need. So we need to be open to receiving the professional interventions that we have around. Like I said, you would go to a medical doctor if you don't feel well, if you have headache, and they'll treat you. Doesn't mean that you don't have faith to pray, but the symptoms are going to impact you. So you go to the medical doctor and they'll give you medicine. It's the same thing for mental health issues. Mental health issues should not, most times you can pray away some of these things. You can pray away how you're feeling. You might need to talk to someone. It's as simple as talking to someone.
And seek professional help.
Yes, seeking professional help, and I think that is so key. But I must also commend the churches. I mean, in Nigeria, they're slowly moving away. I mean, albeit slowly moving away from, the pastoral counseling. I've had some pastors say to me, we don't have the expertise. We actually need you professionals. And we deal with things from faith-based. We agree with them. We can, we share in their faith, but we also give them the intervention that is needed. So the big cultural issue that I'll see in Nigeria is mainly the faith, from the faith point of view, is that, you know, there's nothing too big for God to handle and the likes of that. That would be the biggest thing that we've experienced. Well, I've experienced anyway, and it's just helping them understand that I'm a person of faith, but I'm also a professional. There are different things that you need to do to get that holistic health that you need.
Yeah, I totally agree with you. Thank you so much. Dr. Legune.
So just to add a little to what Busola has said, I think it's all about balance, really. And it's something that I think gradually within our culture, within our society, we are beginning to realize that balance is important. What we've always done is sort of be extreme. So all or none, you know, like Mrs. Busola said, if you were going to your church or to your mosque to seek help, you concentrated on that alone to the exclusion of seeking professional help. Or in some cases, seeking professional help, but denying the spiritual element. If you remember at the beginning, I did say that there's a balance between physical, mental, emotional, social, financial, spiritual. These have to be in a certain balance. And once you're concentrating on one aspect, there's actually a lot of deficit on the other. And eventually, long term, there are consequences to that. So for a very long time in our society, we didn't talk about depression, we didn't talk about anxiety, we didn't talk about bipolar. You know, if you had members of the family who were suffering in that, you know, from any of these conditions, they were not spoken about, they were tucked away. But gradually, I think the narrative is beginning to change. We still have a huge amount of stigma and, you know, stigmatization, but that balance is beginning to come in. People are discussing it. That's partly why we are here today, trying to see how to achieve that balance. And I think a merge of the professional and what other beliefs you have is very key to achieve that balance.
Thank you very much. I think I would like us to go into the triggers, but before we go into the triggers, this is for Dr. Ilegbune. So anxiety experienced by people with comorbidity during the pandemic. And so let's talk about that and how facilities has been able to address these issues in terms of keeping balance for safety and taking care of these people, and also how we can support them. Because, you know, as before the pandemic actually started, there were individuals that had, you know, issues. There was maybe like diabetes, heart disease, cancer, and all that, you know. So I'm sure, I'm thinking that the whole pandemic would have induced certain issues. So how do we support those types of people? Because it might seem that they're just being forgotten and everybody just talking about, you know, COVID.
Right. Thank you very much for that question. So, you know, I'm a family physician. So, you know, what happens is people don't just come to you for, you know, mental health issues. They're talking to you about their physical health. And just to sort of go back a couple of months ago, I think not just Nigeria, the whole world was scrambling. The health sector, the finance sector, you know, different sectors didn't know what was going on. And when you bring it down to our own area, the health sector, I must admit, doctors, nurses, lab scientists, diagnostic, you know, all the hospitals in some cases even closed. You know, they didn't know if they should be seeing patients. They didn't know if just even breathing the same air in an enclosure would. Doctors were afraid. Let me be honest. Nurses were afraid. Everybody was afraid because we didn't know enough of the virus at the time. You know, where we are right now is as a consequence of research and studies and experiences and sharing. So I think we've come a long way. And what was happening at the beginning of the pandemic was that the comorbid conditions, so just like you mentioned, patients who didn't have COVID, but had either diabetes or hypertension or asthma, epilepsy, you know, we have loads of other conditions, just didn't know whether they needed to go into the hospital for their checks, or if they should stay home, should they continue the same drugs at the same dose. There was a lot of confusion, both for the patients and for the doctors. What has now happened, and that brings us to strategy. We started thinking, how do we deliver care, but at the same time, keep our patients safe, keep our staff safe, be safe ourselves? You know, the WHO published a lot of guidelines on how to keep safe. So we had to be isolated, we had to be socially distanced, we had to sanitize, hand wash. How did you deliver that sort of care when you didn't have the patient right in front of you? So that was quite a challenging time. But what has happened, as the confidence in managing this situation has grown, we still have the virus here, but the facilities have all had to come together to think of what strategies do we put in-house. So what I can tell you, at least in a lot of the private sector facilities, what they've done is telemedicine. So telemedicine was this tool that was used in the West. I trained in the UK, and we would do things like telephone triage for patients who didn't need to come in. And suddenly we found ourselves during COVID thinking, how do we reach patients? How do we maintain even dispatching of drugs? What do we do? And so we started using that tool a lot more. So most facilities, what they've tried to do is speak to patients on the phone or WhatsApp or Zoom, come up with appointment structure. So a lot of facilities, you can't just walk in anymore. It's a pre-booked appointment. So you have fewer people in the facilities at every given time. There's a lot of wiping down, decontaminating happening. And what this has done is patients are beginning to feel relaxed enough to speak to their doctors on the phone, WhatsApp, Zoom. I've done numerous Zoom consultations. And in a way, it's also relaxing for them because they're able to talk about their anxiety. At the beginning, they were confused. There was a lot of confusion and anxiety, and people didn't know whether they were coming or going. But what we are trying to do now is to reassure, to support, to say to people, look, you might have diabetes, but you can still be taken care of. You might have hypertension, you still be taken care of. So that's confidence is increasing. And when you do have to bring a patient in to the facility, it's well planned, because as much as you have confidence that you're safe, some of the patients are still very, very nervous about leaving home and coming into the facility. So we've put out a lot of guidelines as well. We have seen a lot of anxiety, not just amongst those with comorbid conditions, but I've seen patients who don't necessarily have any major medical problems, who just have their usual annual check, actually calling in, and they are anxious. And just like Mrs. Bushola mentioned, there are varying levels of severity, from mild to moderate to severe. There are patients right now who never had mental health problems, who are actually going through counseling now. And I'm sure Mrs. Bushola has some experiences as well. And so I think trying to support our patient base is very important. It has become very, it's key at the moment. But as the confidence has also grown for us health practitioners to know that we can keep safe and yet deliver care, whether it's physical care or mental care, we are here for the patient. So that's what we've been doing. Yeah, we are not 100% there, but it's a journey, and we don't know how long the pandemic is going to last. So life has to go on.
Yeah, thank you very much. Mrs. Olamuyiwa.
Yes.
So, when we talked about the mental health issues prevalent among Nigerians, you mentioned depression, bipolar, schizophrenia, right? So, so can we go through that? So what's depression? What's different between sadness and being depressed? What is bipolar? What is schizophrenia?
Okay, so depression, for example, is characterized, so just feeling sad alone, like I said, is not enough. for you to say that you have depression. Like I said, there are certain criteria that an individual has to meet according to the Diagnostic Statistic Manual, which is the DSM. And the symptoms of depression, and the word persistent and prolonged is very key for us. So persistent feeling of sadness, hopelessness, and withdrawal from activities that you would normally, find interest or pleasure in doing, so the word is very key. Same thing with bipolar. Bipolar is a mood disorder, and it affects your mood. You find someone that could be extremely happy today, and the next thing they feel extremely sad. What is also key is the extremities. It's an extreme condition. And again, depending on the severity, it could be characterized by, thought disorder, mood disorder. Insomnia is very common amongst people. Schizophrenia as well is a psychotic disorder. Again, it's very important that I say that you have to meet certain criteria. Schizophrenia is characterized by hallucination, it's a psychotic, a psychosis, delusion, inability to also carry out daily function. Again, there is, a severity. We look at the severity. Sometimes it's mild, and some of these things, especially with schizophrenia and bipolar disorder, they need to be managed using biopsychosocial model, because it's psychotic, it's almost a psychiatric disorder. Whereas with depression, depending on the severity, the most severe form of depression is clinical depression. And when it's clinical depression, then again, we would look at what are the causes, what are the symptoms the person is exhibiting, how long have they had the depression, and then determine what is the best form of treatment. Yeah, but there are criteria that the individual have to meet in the DSM to be given a diagnosis of depression. We have very basic tools that you can use to get symptoms of depression. But for us as clinicians, we can use those tools to sort of assess and understand, okay, I need to admit this person in as a client or as a patient, and then take it from there being that you would need to do more intense diagnosis to give that person a diagnosis of depression.
Great, thank you. Thank you very much. So, okay. So, for bipolar, so you're talking about it being extreme. So it's different from having mood swings, right?
It depends on severity as well. Like I said,
Okay.
it's not just mood swings. Like it's a psychotic disorder. So it's not just merely having mood swings. We all have mood swings from time to time, but there are criteria such as you're looking for thought disorder, you're looking out for insomnia, you're looking out for extreme mood disorder as well. So there are different criteria, and I think according to the DSM, at least the person has to meet like 5 or more of those criteria to be given a diagnosis of bipolar disorder. Yes.
Great, thank you. Also for Mrs. Olamoewa. So a constant stream of news reports about the outbreak and some other news as well may have caused certain people to feel anxious or distressed. So some of us are mentally stronger than others. So how do we protect our mental health from those external triggers? And then what are some of those external triggers as well?
Okay, so you said something that is very key to us, because we deal with people on an individual basis. You know, we look at individual personality because we understand that, like you rightly said, some people are, you know, more prone to stress than the others. Some people can buffer stress, and some people can accommodate stress more than the other person. And this for us, if we're looking at personality and individual difference, there are researches that back up, you know, that theory that certain people, certain personality are able to accommodate stress more than the other person, mainly because of their personality. There's a person, this is very common. We all know extroverts. They have found, based on research, that extroverts, because they use social support very well, because they're good at asking for help, they're good at using what we call problem-focused coping mechanism. They're good at interacting with people. They tend to buffer stress than someone who is high on a personality trait called neurotics. You know, those people, they're sort of shy, sort of, you know, introverted to a degree. But I'm not saying they're introverts, but this personality is called neurotic, but they are not good at interacting, maybe because of some childhood challenges. So this type of people might not be able to cope with stress, but then with some support and with some psychological intervention, they can also cope with stress. Mental health triggers there are situations that cause unpleasant and uncomfortable feeling for any individuals. And these triggers, they range and they vary in different degrees. For example, the pandemic, we've seen that has caused a lot of anxiety, a lot of fear, a lot of uncertainties. People are losing their jobs, you know, especially at the start of the pandemic, what is going to happen, you know, and we really did see that, you know, especially for us as clinicians in clinic, we did get calls from for anxiety. And I'm sure Dr. Oge would tell you this, even as a medical doctor, a lot of people were calling for anxiety. As we progressed and it seemed like there was more uncertainty, people didn't know, then we started to receive the call for depressive moods, you know, depressive feelings of sadness and things like that. And to more personal things such as stress, parents were calling us saying, see, now, normally I would have dropped off my kids at a crash at school, but now they're home with me 24/7. I still have to cook for my husband. I still have to do a lot of other activities. So we saw a lot of stress, a lot of burnout as well, poor nutrition, you know, relationship problems as well, you know, managing, staying at home with your husband, your sibling or whatever for 24 hours and still having to do your work. Most of us, it's a new thing for most people to work online, you know, and so we really did see a lot of triggers during the pandemic. We really, I mean, now I think we've all made some adjustments, and people, and with therapy as well, and with what the organization is doing, this sort of interactions, I mean, conversations that we're having, we see that people are starting to adjust, albeit slowly as well, because we're still getting those calls. People have lost their jobs in this season. People have lost family members as well. So there's a lot of grieving as well going on. So there's a lot of different things that can trigger the global pandemic, down to personal issues, as well as societal issues as well.
Great. Thank you. We will open the chat box very soon, maybe in like 10 minutes. But before we open chat box and take interactions and questions,
Okay.
I think we should, I would also like to get Dr. Oge's reaction. So I want us to just discuss very briefly on the effect of the pandemic on children's mental health. Because children, you know, they're also human beings, they're little humans. And, you know, yeah, so the structure has also been disrupted, you know. Normally, they wake up in the morning, you get them ready to go to school, there's after school, then weekends, they interact with their friends, they go to religious homes or go for a party, you know, so they're socializing and there's a bit of structure, you know. So how do parents and guidance support these children in terms of maintaining that structure. So I think my question is actually in two parts. So in terms of maintaining the structure, and also, like I said, children are also human beings. They're little human, so they also feel the same feelings that we feel. You know, I read an article on how, you know, children are coping with the pandemic, and, you know, there was a survey carried out, and the same emotion that we're experiencing, they're also experiencing it. They're worried. Some of them don't really understand what is going on. Some of them are worried. They miss their friends, so they don't know how they're coping with that. And then also they're worried of losing their loved ones, their parents, because, you know, they've heard this thing is around and it kills anybody, you know, and you're not really protected. So how do we support? In fact, I think it's becoming three parts. So, so I think it would take, maybe I just talk about the third part as well. So how do we then support them to thrive, you know, their mental health? And also the some students, actually, obviously the school is in lockdown, but certain children in like the exit class, just BSS3, will be resuming very soon. So obviously there's a fear as well, because, you know, they've heard there's corona out there. It's killing everybody, you know, you don't have to touch. Somebody can just walk past you or sneeze and then you catch it. So how do we support them, you know, especially the ones that are leaving very soon, you know, to go back to school, to be able to complete their exit classes? So should I highlight the three parts, or I think everybody got it?
I think my answer will probably be one, sort of touching on the three parts.
Okay, great. Yes, please.
So my response isn't entirely clinician, if that makes any sense. My response is going to be from the angle of being a parent myself, okay, and sort of having gone through this whole journey to this point, and also pointing out that, like you rightly said, children are human beings as well. So they are going to go through the gamut of emotion that we are experiencing. But I think the difference with children and adults is we are the children's main support. We are their security blankets, if that makes any sense. And what that means is they feed off their parents or, you know, any other sort of guardian or authority around them. And if we are doing well, to a certain extent, the children relax and realize we are fine. So mommy or daddy or uncle, you know, auntie have, you know, they have this in hand and they feel better. So I think it's actually important for, you know, for the audience, those listening in, to be a bit mindful. There's a bit of mindfulness and intention and consciousness when we are handling this pandemic at home. So you mentioned something, having that structure. So their structure has changed, but making them understand this is new, but it's not, you know, it's not bad. Why don't we come up with a new structure? So many of the children had the homeschooling. You know, even those in nursery, apparently some creche had a little bit of activity going on. And children are fantastic when there's a structure going, you know, in place. So I think to help parents support their children, the first thing is getting a structure in place. It also helps the parents who are trying to work at home. And if you have additional staffing, you know, you have a nanny or you have a housekeeper, you let everyone sort of understand in the morning, this is how we're going to go. So that puts everybody in a sort of a balance. Now, the other thing is, what do you say to the children? They are listening to the news. They are overhearing you, chatting with your friends, with family. There's a lot of misinformation out there. And these kids, you know, my son might be studying in a different part of the living area, and I'm chatting with my husband. Suddenly he pipes up and starts adding to the, and I'm thinking, you're meant to be studying. You shouldn't be part of this conversation. So little ones have very sharp ears.
Of course.
So you also have to be mindful about what you're saying around them. It's not to, you know, get information away from them. No, actually, knowledge is power. And what I would always suggest is let them know what the basic correct information is. So you know you're not going to get this infection by sitting at home and you've not been exposed, because a lot of anxiety actually with the people I've spoken with, even staying at home, they have a sore throat and they think they have COVID, but they've been nowhere near anyone who has had COVID. Psychosomatizing. I've had calls at 11 p.m., patients calling saying, I think I'm feeling hot. And you ask, have you actually checked your temperature? So, it's the same thing with the children. Get them together, have little family meetings and say, right, how do you think you can catch COVID? And what should you do to prevent COVID? So arm them with the right information. You won't catch it by doing this. You will catch it if you do this. So hand wash, social distancing. And the honest truth is most of the children are actually not going out. Even for parents who are stepping out now, going shopping, getting into the office. The honest truth is when they come home, they are particular about washing, hand washing, having a bath and all that. So I think for the children, we are actually going to be the tool that will help them stay balanced. Encourage them to come to you to ask questions. I haven't had any parent who has sort of called up for an appointment for their child, sort of saying, my child is now so depressed or so anxious. And I think, kudos to parents during this period. People have really worked hard to maintain some sort of normalcy and balance at home. Occasionally parents go out, take the children for a walk, try to fit in as many things as you can at home. The other part of the social isolation, thank God for technology. People are sort of organizing little Zoom, meetings with their children's friends. It's happening. We are modifying and we are adapting. And I think because of that, the children are a lot more settled. They are not exactly 100%. These are not normal times. I don't think anyone is 100%, but I personally am not getting, consultations for children who are either depressed or anxious. The parents are trying to contain it themselves. But what then happens is the parents are trying to hold it all together and they are actually getting a bit unwell with the pressure. And, that's where Mrs. Busola, myself, other practitioners out there have to learn to listen and, give that
provide support to parents.
Provide support to the parents, yes.
Absolutely.
Thank you.
Absolutely. And I agree completely with Dr. Oge, talking from a parent point of view. Like I said, the first thing was to psychoeducate my children about the pandemic, not even educate, just educate them about the pandemic. Already the school had done a great job, because I remember my son coming and saying, Mommy, we have to wash our hands now. I saw a little bit of restlessness, let me use that term, as 1 week of no school turned to 2 weeks and 3 weeks. And then he started, during our family prayer, the prayer was now like, Father God, take away the pandemic so that we can all go back to school. So I realized that, he was becoming a little bit anxious and thinking, when is this going to be over? So again, I had to talk to him about it and reassure him. So the first thing is educate them. Second thing is providing reassurance as a parent. Even his daily prayer now is that, Lord Jesus, make sure that this pandemic does not take anybody's life. Nobody dies from, so you could see the little things that the children, might not be saying, but in their mind, there's a lot going on there. So reassure them. And the third thing was to engage them. Even before the school decided they were going to do online schooling, we had a structure in place. We had a timetable, in their room that really worked well, from what we're going to do from the start of the day till literally when they go to bed. We've had the timetable even before the pandemic. I'm always good at doing like a schedule, but then we had to put in more time now because they were going to be at home with me from morning till night. And so we had to do a schedule, and it was great for them. It was great for them to see, like Dr. Oge said, we have technology, so we can, they can interact with their friends. I am so blessed. I have a sister that also has, children the same age as my children, so they can go over there because I know it's a safe environment. I don't want to keep them locked in 24/7. We walk around in the compound. They ride their bicycles. So we find ways to engage them and, continue to provide the reassurance. don't turn them away. This is not the time to say to a child, you're talking too much, I'm stressed, and this. It's only going to increase their anxiety level. So we need to continue to provide that reassurance on a daily basis and keep them up to date. If they say they want to talk to their friends, you know, we shouldn't be as parents saying, oh, do you know how much I have? Because I've seen parents do this, and this is why I'm saying, even if it's once a week, twice a week, let us fit it into their schedule and say, you're going to have one call time to pick a friend this week that you're going to, so that we carry them along. Friends. Exactly. And they're their friends. Would we not speak to our own friends on the phone?
Yeah,
we won't. So why should we not give them that same privilege? Just because they're children, it is not, it's not nice. So we need to find a way to incorporate things and be mindful that even though they're children with feelings just like you and I. They're children with friends just like you and I, and they're going through their life journey just like you and I.
Can I add something else, if you don't mind?
Yes, please.
And yeah, Adefisayo, is it all right to add something to that?
Yes, please, go ahead.
Yes. So we've sort of focused on children who are at home with us, you know, most likely the primary school, nursery, and to a certain extent, junior and senior secondary. But some of us also have children at A level and in a way, you know, uni, who are actually not at home with us. So, you know, this is again from a personal perspective. I have a 17-year-old daughter who is in faraway South Africa, and that was stressful because the international borders closed. And the question now was, how do we engage her? Even though the school has done a fantastic, they have a fantastic wellness and pastoral support department, but your child is your child, and you know, you worry and the child worries. And you know, so for people out there who have teenagers or, you know, early young adults who are not actually physically at home during this period, that's another group you have to sort of think about. What's the best way to support them remotely? So, you know, you come up with a lot more communication with them. You encourage them to call, you call. Again, technology has made things a bit easier. You know, in my case, I also realized, okay, my daughter, I started having girl dates with her, only girls discussions. You know, we have a set day in the week that both of us just hang out. And, you know, so I think it's also easy sometimes to overlook the older children, thinking they can handle it. But, you know, they are still children. And, you know, while you're looking after the younger ones who are physically in your space, also reach out and make sure the older ones, you know, understand what's going on and are keeping safe where they are, and they are able to reach out and let you know if they are worried or concerned, or even if they have a mentor teacher at school, you know, engage them and say, you know, listen, I'm worried about my daughter or my son, and, you know, can you keep an eye and feedback? So I think, you know, that aspect is also something that we should also remember.
And I completely agree with Dr. Oge on that, because again, we must be mindful that, you know, at teenage years is the time that a lot of young people have issues. You know, they're growing up, there's hormonal changes, you know, boys are going through their, you know, puberty stage and things like that. So this is the time to really, really keep an eye, reach out to them. My heart goes out, like I almost want to give Dr. Oge
a hug, right?
When she spoke about her daughter, because it is very important that we keep this age group in mind and you know, reach out to them, make sure that their mental health is, you know, is at the optimal level. They're doing well, they're coping fine. Let us not think, oh, they have their phones, they have enough information. No, don't overload them with information as well. I think it's important that I say that we don't overload them so that we don't create anxiety in them, but at the same time is to reach out and support them, provide those psychosocial support to them, encourage them to have schedules, encourage them to limit the time they expose themselves to social media and the information they're allowing into their space. Yes, thank you.
Thank you very much. Thank you so much. So the chat box is opened. You can drop your questions. So we'll take live questions. now. So you can drop your questions and your interactions in the chat box, or raise your hand if you would like to speak. We would unmute you and then you can ask your questions. So before the live question starts rolling in, so the poll that we did earlier on, right? So which have you experienced any of this, or which are you currently experiencing? So we have stress at 75%, and fear as 57. So stress is obviously the highest. So before we get, okay, all right, so we already have an interaction. So I think after we take the interaction, I would like us to quickly discuss stress management, as it is the highest issue that has been raised here. All right, so just a second. Okay, so I would unmute Ms. Taiwo Jordan now.
Thank you very much. Hello.
Hello.
Hello, good afternoon. Thank you very much, Mrs. Ilegbune, and thank you, Madam Mrs. Olamuyiwa. My question is, how can the employer support the employees in terms of managing this mental health issues? Everyone is stressed. Most organizations are barely making money at the time, so there's a lot of pressure. But what do you think are the steps that HR and management can take to help the employees at this time? Thank you.
Thank you.
Thank you very much, MD.
Okay. So do you want me to take that question?
Yes, you can go first, and
Okay.
Dr. Ilegbune as well.
Okay. So I think the first, having this sort of conversations is very important. But I think one key thing that is obvious is that we sort of, as a country, and I'm not blaming one person, I think we haven't really prepared enough for sort of, a crisis this much. And I say that because, like I said at the start, most of us, as we focused on the biomedical aspect of health, we haven't really invested much in the psychosocial. So I think one way, and I think this is the extreme one for me, is that organizations need to start looking at, we provide covers for biomedical, health insurance and things like that. For people that are experiencing severe level of stress, sometimes it is not enough for them to just speak to someone in HR. From my experience, a lot of people are not comfortable to speak to their staff, to people in HR. So they're rather a professional. So we also need to start having those conversations, even with health insurance companies. How can we provide for a biopsychosocial health insurance that covers, both the biomedical and the psychological, so that people have a safe space to go and talk? Another thing is to continue to advocate for mental health in our organizations. Again, like I said, a lot of people have said the reason why they probably don't talk to people about some of the issues they're going through is that they feel that their organizations are not listening. As a matter of fact, majority of them would also say that the cause of their stress is the excessive workload, excessive demand that doesn't take into consideration that they have a family, they have a life outside work. So it's for us to also be mindful of some of these things. It's for us to be to not just tick off the boxes, but to genuinely be an advocate for people that are going through mental health. Again, our HR as well should be mindful of things like confidentiality. If I've said something to HR before and it gets to Mr. X and I know that they're talking about me, more than often, I'm not going to go back to HR to talk to them. So we need to, prioritize privacy and confidentiality of some of the information that that people have shared with us previously. I hope that helps. Yeah.
Yeah.
You're right.
Dr. Ilekunle, do you want to add anything?
Yes, I'd love to do that. So, just like Mrs. Bushola has said, crisis, if not handled well within an organization, can actually put the employer's health at risk. So I think what happens with the employee-employer relationship has a lot to do with the culture of the organization in the first place. And this pandemic has revealed what cultures are in place in certain organizations. But, you never say never. Some organizations already had a good sort of employer-employee, communication, HR, very active, staff welfare right at the top, while some didn't and are having to start from almost scratch during the pandemic, because they at least understand that if they lose their staff, then there's no company. So there are a number of things I think would be important. So one is, it's also good to have some sort of crisis management team supporting HR, because sometimes in some organizations you have just one HR officer handling the whole group, or you might have HR and a PA. But actually, with this sort of pandemic that we've had, even communication comes into it. So I would usually advise that the organization come up with a crisis management team that would include HR as well, and a few key departments tying in to come up with a strategic crisis plan. Then information is key. When people are left to guess or speculate, it makes them uncertain, they lose confidence, and, both on both sides, employer and employee. So I think it's very important that, in-house intranet communication is going on all the time. People have clear rules and guidelines on what to do. And then at this point, when people are working from home, I've had a lot of my own patients complain that they seem to be working even harder than when they were, right in the office, because it's either from their end, this sense of guilt that, okay, I'm working at home, so I need to prove that I'm working. And you see people sort of going on and on till early hours of the morning, or from the employer end, a demand that, well, you're at home anyway, so I think you need to justify the fact that we're still paying you a full salary. So again, there has to be a balance there, because stress leads to inefficiency, poor work. You might find somebody having done something during the day, and the next day they have to redo the whole document again because they were so tired. The other thing that is important is keeping connected. Again, I must commend your organization for this sort of, series which you've started, because apart from the information that is being imparted all the time, there's a sort of socialization, even though it's remote or virtual. You're all connected. I checked the other time, I had a look at the, participants number. There are huge numbers, listening in, and, people are probably also sending a bit of private messages to each other. That's socialization, and that's very important. Then the other thing is sort of responding when your staff sort of send queries, questions about, so the situation, what are we doing about this and that? Don't ignore emails or phone calls from members of staff, because sometimes it's actually a sort of what I call a red herring. Somebody's contacted you under the premise that they want to discuss X, but actually what they want to discuss is Y. So, keep that going on. And then for those who have to go into the office, there's a reassurance that, that the employer management is saying, oh, these are the guidelines that we have in place for keeping you safe when you do come in. So it could be a staggered rota system. It could be, seeing that the cleaning team are decontaminating surfaces all the time. That also helps, mentally, that, okay, I'm going into work and I'm unlikely to catch COVID from just being in the office. And then just keep updating your staff, whether it's on a fortnightly basis, situations. And if anything changes within the company, either, you're going to have to consider things like payment costs, or, tell people, don't leave them out there to speculate and to guess. So I think in the way, if organizations had some sort of structure like this in place, you know, you have to tailor it to your own organization and tweak it. I think in a way that would help both the employer and the employee to feel, you know, that they're all doing their best within this time.
Okay, thank you. Thank you very much. So can we get other questions and interactions in the chat box? You can also raise your hand if you'd like to ask a question so we can unmute you. Okay, so while we wait for the comments and the questions, you know, I did mention that the poll that we ran did have highest participant pick 75% are actually struggling with stress. So can we talk stress management? What are the things that we can do to manage stress? How important is the support system in stress management?
Okay. So stress in itself occurs when an individual's coping mechanism, you know, is low, basically. And coping in itself is basically what people do to minimize stress. So stress is not just the one-sided thing. There's a lot of factors that cause stress, and that in itself needs to be identified. So is it work stress? Is it a combination of factors, family, home, career, you know, and there are different things that people can do to cope. And we've already talked about some of those things. There are people cope by using four types of coping that we know as psychologists. The first one is called the problem-focused coping. The second one is called the emotional-based coping. The third one is called the appraisal coping, and the fourth one is that people use social support. So for problem-focused coping, which is why I said it is important that the person identifies what the cause of that stress is. For in using your problem-focused coping, you will be looking at addressing the cause of the stress and removing it and eliminating it. So for example, like I said, I realized that I was becoming stressed. My stress level was going up because my nanny left, and I still had to do not just the same amount of work, but a little more. And then someone that was helping me to cope with stress has been removed. So what did I do? I had to put some structures in place. I had to, you know, manage my time effectively. If I was going to bed maybe at 1 a.m. because there's a pandemic, and I know that I need to get up, get my kids ready for online school and things like that. Now I needed to reduce that time and probably drop my phone and go to bed at, you know, 10 a.m. So it's using direct approaches to deal and manage the stress. With the emotional focus, you're looking at altering the feelings attached to the stressor. So for example, people use what we call pep talks. They'll talk themselves out of it. It's not that bad, you know, in order to change their emotion. For some people, they'll use exercise, nutrition and things like that, because maybe they've used it before and they feel that it improves their feeling. It's just changing the feelings attached to the stressors. And then you use appraisal focused as well. It's changing your thinking around that stress. Oh, you know, if I don't do this thing, my life is going to end, or, you know, and people use some of these things, but changing your thought processes. And one way that we found that is very effective is to write down your thoughts, write down what you're thinking, and try to see, is it the result of this stress, or is that truly who you are? For example, some people will say, I'm not good enough, I'm not good at this job. Is it because you're experiencing stress at the job and there's just a lot to do and you're feeling overwhelmed? And it could just be for the time being. So writing down your thoughts and try to identify if it is connected to that particular stressor at that time. Then social support is a big one for us as psychologists, one that we encourage and part of what we're talking about today. You know, we are all connected to this world through, our families, the people that we know, our friends and our loved ones. And people use this as a means to cope. So when people call me and say, I'm experiencing stress and burnout, one of the key things that I will ask them is, how is your family life? How is your social life? How are your friends? If they say, well, I have a fantastic social network and I use it, not just family and friends, part of our social network also includes work, work colleagues that support us, that know what, when to pick us up when we are just down a little bit. Those supports are very, very key, especially in a work environment. So that is, and another thing that I think I've already discussed is the personality. Personality is a big factor that also determines whether an individual will cope with stress or not. Some personality accommodates stress, easily, and they fall when they are stressed, they have a breakdown. Some even in more severe forms, they go into depression, anxiety, and the likes, while some other personality are easy. They can easily buffer away stress because they use their coping mechanisms. They're quick, and one personality is known as the conscientiousness. They are very good at using problem focus. They're very good at regulating their emotions, and extroverts as well. So I think what is key is to know yourself, know your limits, understand your person. Take personality tests if you need to understand who you are. Are you someone who can cope well under stress? Are you in a job? It's not unusual that when people come into my clinic and I say, do you love what you do? Most people's response will be, well, I need the money. There isn't enough job. But you're almost collapsing. You're having depression. And these are conversations that we need to ask. Are you in the right environment? Is that environment causing you more stress and even leading towards a mental health issue? So using your coping mechanism, but in order to fully use, whether it's the problem-focused coping, whether it's emotional focused coping, whether it's the appraisal or the social support, that individual has to have what we would say, to some degree, good mental health. Because when we look at the definition of mental health in itself, is someone who can think rationally, who can cope with stressors, and who can impact their life. And if people are not doing this for a certain amount of time, especially for me, I would always say to my patients or my clients, I would say to them, if you're not coping for a period of more than 2 weeks, it is time to talk to a professional. Whether it's going to your GP and then your GP refers you to a psychologist or a psychiatrist, the GP should determine. And I've worked with Dr. Oge for some time. She's very good at doing that, yes, that's it basically.
Thank you. Thank you very much, Ms. Lamayiwa. Dr. Oge, do you want to add anything?
Yes.
Okay.
There was something Mrs. Busola mentioned about actually knowing yourself. And I wanted
self-aware.
being self-aware. And some people can do it themselves. They really know, who they are and what their triggers are, while others are a bit more, challenged in getting to that point. I remember growing up and watching films, and we're laughing at people in the West, that everybody seems to have a therapist. Oh, everyone seems to have a therapist. But actually, having a therapist, a counselor, a psychologist doesn't actually indicate that you have a mental health issue in that sense. Sometimes you haven't got to a point where you're severely depressed or you actually have a diagnosis of bipolar. I know people who just have a psychologist or a therapist that they go to have chats with just to keep them balanced. So just like as a family physician, every year I send out to my registered patients, reminders that, okay, your blood pressure, you're due to have your blood pressure checked, you're due to have your sort of basic blood tests done, X, Y, Z. And some of these people are not diabetic or hypertensive. It's that part of self-care. And I think as we give attention to physical health, we do have to give attention to mental health. We don't have to get to a point where we are utterly mentally emotionally exhausted and drained to the point of, in some people, becoming suicidal, to actually, you know what, I need to identify who I am and what my triggers are so that I can put these various coping mechanisms in place. Like Mrs. Busola said, we are all different when it comes to how we handle stress. You know, in the office, I'm sure you have colleagues sitting around and you have a crisis and you just see someone, you know, running around really flustered, and you see the other person getting up, going into the kitchen, getting a nice cup of tea, you know, and you're wondering, are we not in the same office handling this problem? So I think it's important that we begin to, especially in our environment where for a very long time we've had this sort of stigma, pushing things under the carpet, and yet people are dying inside. I think we need to get to a point where we recognize that there is no problem talking to a doctor, you know, saying, listen, I need to get some help in just knowing what my triggers are. You don't want to get to the point where you can't even handle, you know, the situation, and they might need to give you some medicine to get you stabilized before, you know, you continue. So I think for me, that's my own sort of input, that I think, you know, everyone needs to try and learn the balance between physical health and mental health.
Absolutely.
I totally agree. Thank you. I mean, for me, what I take is being, you know, understand yourself and the triggers as well. So thank you very much for that. So we're taking questions and interactions now. Nigerians and people in general, I hope it's okay I mentioned the person's name, Olasokomi. Nigerians and people in general believe that money is a motivational factor in managing mental health challenges. What can be done to change this narrative?
Okay, so money is a motivational factor in terms of, is it how much they need to pay, or, you know, motivational in terms of, anyway, I think if it's in terms of the expenses, you know, that people have to pay to see maybe a mental health practitioner, yeah, globally, mental health, psychological services, let me talk from, yeah, is expensive. Our sessions are structured in a way that we do clinical interview, sometimes using for every clinical psychologist, and I know that there's clinical psychologists on days, they would agree with me, we tend to go back to childhood, you know, trying to understand the person in a holistic manner, not just taking the present, you know, what they're saying to us. So sometimes we're in session with a client for more than 2 hours, sometimes trying to understand that. In doing our psychological or personality assessment as well, you know, in order to give you an adequate diagnosis, we would sometimes use clinical tools, expensive clinical tools, which is why, for me, I mentioned earlier, if we can have health insurance, I can't think of a Western country that doesn't somewhat cover psychosocial intervention at this stage. And I think it's important that as a country that we have those conversations. I really am grateful to Accion. Am I saying it right? I've been for having this conversation, Accion, and for having this conversation, and, you know, trying to bring more awareness. But at the same time is to start to ask the health insurance companies to cover for psychosocial interventions, not just for us as psychologists, for social parts as well. You have occupational therapists. Sometimes I can't do everything. I want to refer my clients to go and see an occupational therapist, but again, they're going to charge them. So the client is saying to me, sometimes to even a dietitian, sometimes to a nutritionist, because I can't do everything. I need to focus on my own speciality. But because a number of these things are not covered in our health insurance, we have focused too much on the biomedical, at this point, it should be unethical. But to be honest with you, most countries is either you have the government subsidizing for people to go and see a psychologist, unless you want to see a private psychologist. I practice in Ireland. I know that this, especially in the general hospitals, they're heavily subsidized. If you want to see a private one, you can afford it, then you go and pay. But even globally, to see a psychologist, you're looking at 100 to 150. I can't even dare to charge close to that amount here in Nigeria because people are not going to pay. So it's to start to ask for other means that these services can be covered so that it will be cheaper for people. I believe one way, like I said, is the health insurance. We should ask them, is it possible that you cover, even if it's for 2 sessions, maybe for a session whereby one of your staff just come to unburden. You know, again, is to have us in, and I think Dr. Oge would agree with me, we've done some of these sessions where we bring the team together and we have an unburdening session. You know, people express themselves, people talk about what they're going through in a group manner. In that way, it's a lot cheaper for the organization as well. These are things that we need to put in place to support our staff. And I hope that answers the question of Mr. Olasukomi, if I'm correct.
I hope so. So there's a part 2 of the question, and I think someone else raised that question as well. Can one's temperamental status help one to deal with health challenges?
Okay, yeah.
Can I take that again?
Yes, temperament. Yeah.
Okay.
So you're looking at the temperament. Yes, certainly. You know, for someone, again, I don't look at it in isolation, and it's very important that I just don't look at things in isolation. If, for example, we see someone that is angry, or someone that just, you know, always have an anger outburst, we see the behavior, but there are other factors that we don't see. We don't see yes, we don't see the hurt, we don't see the pain, we don't see, you know, what has happened. For example, you walk into an organization, Mr. X, you greet Mr. X and Mr. X doesn't respond back. And maybe 2 weeks prior, you said hello to Mr. X and he completely ignored you. You know, your mind naturally would go into Mr. X doesn't like me. Thereby, I must also show Mr. X that, you know, who is boss around this place, or the other behavior there might be to withdraw. So anger in itself, you know, there's something behind the anger, and it would take a clinical interview. So in your temperament, how can your temperament help? If you're very calm, you're very easygoing, and it is normal, you know, as long as in terms of your emotional well-being, you're not over-pleasing people, you're not doing anything to sort of submerge yourself to other people, and it's worked well for you. It's not to change people. What we're looking for is the abnormalities, is something that is not normal to you. So if you have a good temperament, you're loving, you're jovial, that's how people have always known you, it works well for you, by all means, it can help you deal with, you know, mental health issues. Or your mental health state or mental well-being. Yes.
Great, thank you. Dr. Oge, would you like to add anything?
Yeah, just a little addition. I think within the work environment, because, you know, this is sort of tailored to organizations. I also think there's a certain element of being your brother's keeper that also comes into being part of a team, not snooping or prying, but you know, there's a word we tend to use when we're doing a bit of history taking of patients, and that's a pre-morbid personality. In other words, how was this colleague, you know, how was this colleague before you actually noticed this change? So some people will say to you, in the past month, we've actually observed that this person is angrier all the time, or they are very withdrawn. I think, you know, there is a sense of, you know, sort of a degree rather of responsibility when you've worked with people, you know, for a while, that even though you're not really trying to pry, it's good to sort of flag up a few things. You know, the discussion then would be, what is the proper and appropriate and confidential route to flag up something if you actually observe that your colleague is quite different? Their pre-morbid personality doesn't seem to be, you know, tying into the recent changes you found. Because, you know, at the end of the day, I think we've all sort of seen an increase in things like suicide, even within our environment. And they say, oh, the person was at work last week, and then the following week you hear that this happened. You know, the psychologists are having a lot more sessions with banks and companies because they are dealing with a lot of, people who are becoming quite depressed. So again, I think organizations need to put in place some sort of very confidential ways of, you know, encouraging. And it's not to sort of pry into people's private lives. But I think if you go in a company for a certain length of time, you know, there is a brother's keeper thing that comes on. You know, if you see someone, your colleague who sits across you, normally they would come in, they'll say hello. And over a month or 2 months, you know, they are looking haggard. They're not talking as much. Something is wrong. And to ignore it is not actually the right thing to do. So I think, you know, the welfare HR department might need to come up with a structure where people feel confident approaching to say,
seek for help.
Seeking for help, or, you know, flagging up something. So I think it's very important because, you know, people are not saying a lot, and everyone's sort of getting into difficult situations when actually it shouldn't happen.
Yeah, thank you very much. Thank you. So I would unmute Mrs. Mojisola Gaba, and then we'll take some questions and interaction from the chat box.
Okay, thank you. Good afternoon, all.
Good afternoon, Ma.
I've actually really gained so much from this actual discussion, but I'm going to take up my dear sister Olubusola. There are two things actually concerning women. I mean, you find out that I experience it when a woman is going through menopause, and at the same time, maybe you are almost, or you are like maybe 60 plus. There is a way you feel. How do you handle that? Very important for me. Thank you.
Thank you. And that is very key for us. So we look at hormonal changes, we look at, you know, age factors. Just like I said, we look at personality factors. Basically, in dealing with this in a psychological intervention way, I would say that the best thing is, you know, to come to us as psychologists to identify. So you've already identified that, you know, age is an issue, and obviously the physical changes that you're going through. The first reference point for us will be to go to the doctor, you know, and then what are the symptoms? What are the things that the doctors are looking at in terms of the menopause? And then for us, we will then advise, you know, some things that you can do based on that. Are we looking at, you know, managing your physical health in terms of exercising, your diet, things that can improve your mood, things that can, you know, people use supplements, people use, there's meditation, there's yoga, anything that can help to calm you and relax you, you know. So relaxation techniques, like I said, yoga, and we don't have to do yoga in terms of the Buddhism one, anything that connects your mind with your body. So we're looking at techniques like mindfulness, you know, being mindful that, you know, you have this condition, but just being mindful, connecting your mind to your body, and letting the two sync and being in that relaxed mode. And we found that have helped people, especially people at a certain age, you know. So it would be general lifestyle, you know, lifestyle adjustment and management. And I do have patients who have advanced in age, you know, and putting just those little things in place, you know, such as the physical health, the diet, you know, the the social support as well, get talking to people that have gone through or are experiencing the similar things that you're experiencing. We have social support group for different things now. We have cancer social support group, we have diabetes social support group, we have elderly social support group, and I can encourage you to also start such a support group as well. Because once you know that there are women that are going through similar things that you're going through, you don't feel so isolated, and you can bring in a psychologist, a medical doctor to talk to these people. But just knowing that there are other people going through things and sharing what has helped for people would help you as well.
Thank you very much. Thanks.
You're welcome. You're welcome, ma'am. Thank you, ma'am.
Thank you very much, ma'am. Okay, so a question: what is the role of government in managing the mental health of its citizens? In Nigeria, you get to see a lot of mad people on the streets, unlike the Western world.
For me, the word.
That's a difficult question.
We don't. So first of all, if we talk about stigmatization, some of the things that create stigma is using, terminologies such as mad people. Like we have identified on this platform, not everyone that needs to see a psychologist, and I dare to say not everyone that needs to see a psychiatrist, has mental illness, has psychosis. So using those words are outdated. Someone living with mental health condition, will probably be the ideal word. We've all heard it, there's no health without mental health, and all we need is just help along the way. So in Nigeria, I think we see it as more prevalent because, for us, what it means that people have a mental health issues is someone in tattered clothes, someone walking on the road, someone talking to themselves. But that is not, that is no longer a criteria for saying that this person has mental health condition. Abroad as well, there are a lot of people living with mental health. There are a lot of celebrities. I mean, we've seen with the recent one, Kanye West, we know of Jim Carrey, the popular funny man who has dealt with depression for a really, really long time, Leonardo DiCaprio. So there are a lot of people going through, but just because they're not in, ripped clothes or tattered clothes and walking on the streets, talking to themselves, does not mean, as a matter of fact, I saw that recently about 18 million people reported mental health condition, one degree or the other, in Europe last year alone. So there's a huge number. Yes, there are a lot of people, but sometimes we joke with some of this world. This person is mad. I see this person talking to themselves. Does not mean that that person actually has mental illness, and we need to change what we see as mental health. Is not just someone walking on the road who is mad, who is roaming around the street, talking to themselves and throwing rocks at people. There are quite a number of people going through a mental health condition. Even dysfunctional relationship can impact on our mental health. A boyfriend breaks up with you suddenly, this can impact on your mental health. It can lead to depression. Does that mean that person is not going to be able to function adequately in other areas? Certainly not. So we need to move away from some of those terminologies that we use: mad people, psychotic, this person is, we need to begin to change those narratives.
Thank you so much. Thank you. Question, Dr. Oge, in case you want to add anything, please just jump right in. So
there was a part to that question as well about what the government is doing about the people. And that was why I started, in a way, laughing, and said it was a difficult question because I honestly don't know what the government is doing. And the question, I think, also brings us to what our health infrastructure is in place. So Mrs. Busola has said a lot about health coverage for everybody. you know, to be able to access health care, whether it's your physician or the specialist or the psychologist or the psychiatrist.
Yeah.
And without that system in place, you know, at the very foundation, we don't even have that sort of welfare for the average citizen of the country.
Yeah.
Sometimes when you see people wandering around unwell, it might just be because, one, they couldn't even afford to get into a hospital to be assessed. And then secondly, obviously, like she also said, we're dealing with the stigma. You know, some families just turn their eye away and feel, right, we can't be associated with this sort of, in quotes, madness. So at the moment, you know, it breaks my heart. I've seen a couple of, you know, people on the streets, and I'm thinking, you know, if it's abroad, an ambulance would already have arrived to take the person to the nearest hospital. You know, they don't care who is your next of kin at that point. They just take you there and then begin to try and trace where you're from and, you know, give you some emergency psychological and psychiatric support. So we are a long way, very long way, but I think changing the narrative, having the conversation, and hopefully it will trickle down to the government, you know, when policies are made. Because when you talk about the government, it all boils down to policies. You know, you have to have something in place that the government can then say to everyone, these are the rules, this is how we're going to approach this situation. And hospitals and facilities will, you know, and even the health insurance group will, you know, start listening. So, you know, we do need universal health coverage in this country.
Yeah.
People are suffering really badly.
Absolutely. Thank you very much. Okay, there's a comment. Thank you for such an engaging session. I think we took this already. What is the place of temperament? So the next question is, how can we identify staff with traits of mental health or psychosocial challenges, and how best can we as management and HR / help such staff?
Okay, I think Dr. Oge sort of touched on that a little bit, and she spoke about someone that acted, or has always been in a certain way, and you start to notice, and I spoke about it, it deviates from what is normal to that person. You know, that is a big red flag there, you know. So this person would normally come in cheerful, and suddenly they start to withdraw. They're they're very absent from work, you know, in terms of, you know, managing their time, deliveries and things like that. They're not delivering as they normally would, you know. That is also a red flag for you to know that, or to just invite them and say, is there something going on? We noticed over the last month or 2 weeks or so that your work has not been up to date. You're not coming to work as, you know, like she said, is to be a brother's keeper in a non-judgmental way, at least at the initial stage, especially for an employee that has been within the organization for more than a year, even 6 months, and they've acted a certain way up until maybe a month ago, and they started to deviate from the normal. Again, you know, some of them, they might cry a lot more often than usual. The anger outburst as well. So you start to look for all those behavioral traits. Sometimes they come to work very tired. So maybe there's symptom of insomnia. They're not sleeping well. They're fatigued. You know, these are some of the signs. And the big one for us is, you know, their appearance, you know, hygiene and stuff. Someone that would normally look well, take care of their physical appearance, have their hair nicely done. Then you see them, they're not really looking the way that you would expect them to look, or the way that they would normally look. So these are things to look out for, and then bring them in a non-judgmental way. Suggest to them if they would like to speak to someone, whether the HR or, you know, someone at the top that you feel that they'll feel confident or safe enough to talk to. Anyway, so it's just looking out for those physical symptoms, but not just the physical obvious ones. Some of the things that they would normally do. They'll say hello when they come in and things like that. And I mean, the physical one, the behavior is something that we can see. And if we see the deviate from the normal, then we need to start to find a way gently to get them to speak to someone.
Yeah. Thank you. Thank you very, very much. So another question. Hello, thanks for this. It's very insightful. Please, how can I cope with an overbearing boss who always seems to find fault despite all the hard work I put in?
I think Dr. Oge should take that.
Okay.
I think this is a very common complaint, isn't it?
Yeah,
most people on this group, and with all due respect to Accion, I'm not referring to you, but we've all worked in different places over the years, and I think once in a while you do come across, a boss that just seems difficult to please. I'm not sure my answer is entirely clinical, obviously, because again, this isn't just about physical health, or there's a sort of a balance with this question that one has to try and achieve. So you have the other part of it, which is this boss. Is this boss like this with everyone? I think it's important to always look at a situation logically, where I also notice in this part of the world, we are very sensitive, to take things very personal. I think it's always important to, first of all, look at the situation and find out, okay, has this boss always acted like this? Is this a strength of his or her expectations of the people she works with? What is the culture? What is the mission and the vision of this company? So that's one. When you identify that it's not actually personal, it has nothing to do with you, this is just how this person works, these are his or her work ethics, it doesn't necessarily justify making you miserable in the process, but at least you can take that box off. Then the other thing is to look at yourself in terms of how do you deal with stress? How do you deal with crisis? How do you deal with your workload? And in fact, do you like the job you're also doing? I never think it's a very straightforward answer that, oh, a boss is out to get you. I think sometimes there's a medley of different things, dynamics coming into that situation. And, Mrs. Busola has also mentioned personalities and coping skills. So it might be important to sit down. You could actually sit down with someone else. It doesn't even have to be someone who works in that environment, but somebody who can give you a degree of objectivity. You lay out the situation, and then you logically look at the boss, you look at yourself, you look at the work, and then sort of arrive at a situation where you might say, okay, actually, it's half and half. The boss might be doing this, and it's not exactly right, but I haven't equipped myself to handle this, and how best can I do it? There's a fine line, though, between harassment and bullying at work. So it's also important to know where that line is. If you actually then begin to feel so harassed and so bullied that even your mental health is being affected, then it is time to speak to your HR and, mention that this is going on. On the extreme, you start looking for another job. The only thing is there's never a guarantee that you get another job and the person, you don't meet similar personalities there, which is why I think from a logical point of view, you also have to, in a way, self-analyze yourself to be sure that it's not just you, but, that there are other external factors that are coming into place. I do think there should be, in every organization, a way that employees can come to welfare or HR to mention that there is a situation that they are troubled about. But many people don't, especially if you're complaining about a line manager or, your overall boss, how do you report the boss? And I think, again, it's probably not using the word reporting. Change the terminology to make it more comfortable so that people can actually, approach HR to mention that they are having a bit of difficulty. But I think you still, people still need to look at themselves, look at the situation, get somebody in to also be a bit of an objective bystander, and then, take it from there. So, I hope that helps a little. It's usually a difficult situation when you have a difficult boss.
Yeah, I hope that answers the person's question. Please still drop your questions in the chat box or raise your hand so you can be unmuted if you would like to speak. So gradually we're coming to the end of the session. I've had a very wonderful and awesome experience. And I'm very grateful to Dr. Oge and Mrs. Olamuyiwa for joining us. It's been very insightful for me, honestly.
Thank you for having us.
Thank you.
So before we close, you're welcome. Before we close, we'll want to run the second poll. So that would come up in a few seconds. Please select the answer most appropriate to you. We just want to find out your experience about the session. How was it for you? What can we do better? Okay, so while we wait for that, there's another, okay, so while we wait for the poll, can I have the poll up, please? At the beginning, this is another question. At the beginning of your lecture, you linked mental health to psychological and social issues. How does mental health affect our social behavior?
Okay, so basically, like I think we've already dealt with this to some degree. Mental health affects the way we behave in terms of, even taking, for example, like I said previously, someone who is going through her mental health or has some degree of distortion to their brain might not be able to interact with their environment as they would normally do. They might not be, so absenteeism from work is always a complaint. They might be withdrawing socially from people, isolating themselves. People that are known as social butterflies would then begin to, not pick up calls, not respond to messages. This is just what is normal for this person, and then they begin to behave in the other direction. I don't want to use the word abnormal, but it's just moving away slightly from what is normal for that person. So it influences our social, even impacts our interpersonal relationship, family relationships. It's not uncommon that family members would say, oh, this person has locked themselves in, they've locked themselves in the room for X, Y, and XY. They're constantly on their phone. They're constantly on social media, so the social interactions, relationship with friends, with colleagues, with people is impacted, but not just that, even work is impacted. Things that you normally enjoy, activities that you normally would do, going to the gym, this is also impacted. And this is often for us one of the first tell sign that people will complain about. I don't know, this person has locked themselves up in the room. So it impacts on our social, it impacts on our physical health, it impacts on our mental. In the physical, for example, you like I said, you have fatigue, you have weight loss, and the social as well is impacting on the person's social network, social activities, and things that they previously enjoyed.
Great, thank you. If somebody is diagnosed with a personality disorder, their thoughts, feelings, and behavior might make it hard for them to always maintain a good relationship with you. What are the things you can do to support them? So this is supporting someone that has been diagnosed with personality disorder.
Okay. Dr. Oge, do you want to take it, or should I take it?
I think you should. This is definitely in your space.
So,
because, in training, I remember when we did psychiatry as part of our rotation, personality disorders are quite tricky to handle. So I think over to you. Yeah.
Okay. like personality disorders are tricky to handle, but it also depends on the diagnosis as well. You know, you know, we've all heard of narcissistic personality disorder. We've heard of some other personality disorders, such as there's one that is very common that is coming to my, that I've just lost my train of thoughts there. But there's one that I know that even for you as an individual, it's very hard to pinpoint. It's very hard to see it as a personality disorder because it is masked, you know, by, you know, just this person know, and it's similar to the narcissistic personality disorder. People mask it very well. You can't even tell it's a personality disorder. They're good at engaging people. They're good at telling you that, you know, everything is well, but in a way you can see the control and the manipulations in there. So for you, I think the best thing as well, because I'm also mindful of people's mental health. I don't want people to think that, okay, it's all about the person and then they neglect themselves. So for you as well is to identify, is this something, what is your relationship with the person? If it's a family member, it's often hard to neglect a family member. So how are you supporting them? You know, be there, listen to them, and also suggest that they see a professional who can then help them to manage whatever personality issues that they have. For someone with a narcissistic personality disorder, it's always difficult to manage because there's the control and manipulating others that is very prevalent with such people. So you want to be careful as well how they're very good thinkers, they're good with answering your questions. So think about, I mean, protect yourself, but also advise them to seek help in a non-judgmental way. So we're not attacking them and saying, you know, your personality is this. Now I know what you have. It's not unusual that people come into our clinic and say, you know, people have told me that I have this XY personality, and because of that, they judge me. So don't judge people, but also at the same time, help them to identify that, you know, you might have some issues here and there that you need to work with. Would you like to speak to a professional? But make sure that you're also protecting your own, you know, mental health and your own peace as you interact with these people. Yeah.
Great, thank you very much. Thank you very, very much. The poll is still up. Please select the answer that best applies to you. We have less than 50% that are of participants that has actually voted. So please do that. Thank you very much.
Adefisayo, may I just mention something which
Yes,
has
please.
been which has cropped up a lot over this period? And it's not directly mental health, but it's that balance. We found that many people who are diabetic and hypertensive and, you know, need to do their annual checks because of the COVID, the pandemic, actually started dropping off the radar. And we've actually had a number of real bad you know, mortality from non-COVID, actually. People who have gone into some sort of diabetic crisis or hypertensive crisis. So as much as the anxiety has been rising and the depression, we as the family physicians have also found that the poorly controlled diabetics and hypertensives and some strokes and some comas have also been, you know, rising. And then people have stopped going for their cancer screening at this point. So I just want to, you know, put it out there to everyone that, you know, if you know you have some comorbid condition, which will be the case because 1 in 3 Nigerians are hypertensive, actually have raised blood pressure. Please call your doctor's clinic or hospital, find out what the protocol is for them to see you for your checks. Don't sort of wait until the pandemic is over. We do not know when this situation will be completely over. So, you know, make that contact your doctors, contact the nurses, nursing practitioners, and find out what your facility has in place for your checks. The same is true of having your, breast screening done, your cervical screening done, your prostate screening done, because we also know that some of these sort of cancer cells can grow at a very fast rate, and early detection is key. So again, reach out to your HMO. HMOs have been quite active during this period, trying to sort of engage with clients and all. Find out what is happening out there. Don't focus entirely on COVID. Life still goes on. Without COVID, we still have these other conditions. And please just, take care of yourself at this time and make sure that your checks are still ongoing. So I thought I should mention that, please.
Thank you. Thank you for adding that. That's really important. That's actually all the time we have. Thank you once again. Thank you, Dr. Ilegbune. Mrs. Alamuyiwa, thank you very, very much for taking time out. Thank you. It's been very wonderful for me and very awesome experience. Thank you very much.
Thank you. We appreciate it.
Yes,
thank you so much. Thank you for lending your voice.
Thank you.
For the advocacy of mental health.
Yes, thank you.
We hope that this will be one of many to come.
Yes.
We continue to do this. Certainly.
Yes.
All right. Thank you.
All right. Well, keep safe, everyone. Look after yourself. And thank you, Adefisayo.
Thank you very much. If you'd want to still contact our speakers, Dr. Ilegbune and Mrs. Olamuyiwa, the details will be shared very, very shortly, so you can reach out to them and contact them for maybe private sessions. Thank you so much for taking time out to join us. Please follow Accion MFB. Follow us on social media at Accion MFB for more information on the bank's products and services, and then also on the upcoming episode of our Connect series. You can also follow our knowledgeable speakers. Their details are being displayed, and then reach out to them directly or privately. Thank you very much, everyone. We hope to see you next time. Don't forget to follow us as well. Our Accion's contact details will also be shared, so you can also follow us on social media. You can send us a direct message. We're on Facebook, LinkedIn, Instagram, and Twitter. You can also give us a call or send an email to info@AccionMFB. The website is www.actionmfb.com. Thank you so much for joining us.
Thank you.
Thank you very much.
Bye.
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 Thank you very much, everyone.
Bank, I tell we the best, I no settle for less. Bank where they make it life better. With shaking the money, you fit open account. Save money now to pay your bills, and you fit to get the loan to grow your business. Well, my future is bright, oh. My future is bright, oh. With Accion Bank, with Accion, oh. My future is bright, oh. With Accion Bank, with Accion, oh.
Accion Microfinance Bank. My future is bright.
Hey, Accion, *572#. Now the code Accion, *572#. Money go. Open accounts with Accion to save for tomorrow. You bank every day. Hey, *572#. Now here we go. I know get to a partners on top your phone, wherever you are, whatever you do, they pay your bills and recharge your phone.
Accion Bank kwe kugo kun piano *572#. When you learn
Maṣe ìyọnu láti lọ sílé ìfowópamọ́ ìwọ ṣáà ti tẹ *572# lórí ẹ̀rọ ìbánisọ̀rọ̀ rẹ.
Accion Microfinance Bank. My future is bright.
Nítòótọ́, ṣé pé tí mo bá ṣí àkáǹtì pẹ̀lú Accion wá máa máyé rọrùn fún mi?
Ina son iya karɓar kuɗin Accion banki na yi amfani kai ƙara kasuwa ta.
Chai, Accion Bank mo kwara ni ATM card.
No need to stress, I no need the stress. With Accion Microfinance Bank, I tell with the best, I no settle for less. Bank where they make it life better. With shaking the money, you fit open account. Save money now to pay your bills. And you fit to get it loan to grow your business. Well, my future is bright, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. Is bright, oh.
Accion Microfinance Bank. My future is bright.
Accion, *572#. Now the code Accion, *572#. Honey, go. Open accounts with Accion to save for tomorrow. There's an easy way to bank every day. Hey, *572#. Now hear me the code. I know get wahala. Oh, it's a life. Oh, money on the go. *572#. Oh, get a life. Oh, my future is bright. *572#. Send money to family and friends and business partners on top your phone. Wherever you are, whatever you do, hey, pay your bills and recharge
Jiri ni
your phone.
Accion Bank kwe kugo phone. Piano *572#.
Maṣe ìyọnu láti lọ sílé ìfowópamọ́ ìwọ ṣáà ti tẹ *572# lórí ẹ̀rọ ìbánisọ̀rọ̀ rẹ.
Accion Microfinance Bank. My future is bright.
Nítòótọ́, ṣé pé tí mo bá ṣí àkáǹtì pẹ̀lú Accion wá máa máyé rọrùn fún mi?
Ina son iya karɓar kuɗin Accion banki na yi amfani kai ƙara kasuwa ta.
Chai, Accion Bank mo kwara ni ATM card.
No need to stress, I no need the stress. With Accion Microfinance Bank, I tell with the best, I no settle for less. Bank where they make it life better. With shaking the money, you fit open account. Save money now to pay your bills. And you fit to get it loan to grow your business. Well, my future is bright, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. Is bright, oh.
Accion Microfinance Bank. My future is bright.
Accion, *572#. Now the code Accion, *572#. Honey, go. Open accounts with Accion to save for tomorrow. There's an easy way to bank every day. Hey, *572#. Now hear me the code. I know get wahala. Oh, it's a life. Oh, money on the go. *572#. Oh, get a life. Oh, my future is bright. *572#. Send money to family and friends and business partners on top your phone. Wherever you are, whatever you do, hey, pay your bills and recharge
Jiri ni
your
Accion
phone.
Bank kwe kugo phone. Piano *572#.
Maṣe ìyọnu láti lọ sílé ìfowópamọ́ ìwọ ṣáà ti tẹ *572# lórí ẹ̀rọ ìbánisọ̀rọ̀ rẹ.
Accion Microfinance Bank. My future is bright.
Nitoto, ṣé pé tí mo bá ṣí àkáǹtì pẹ̀lú Accion wá máa máa rọrùn fún mi.
Ina son iya karbar kudin Accion banki na yi amfani kai kara kasuwa ta.
Chai, Accion Bank kung para ni ATM card.
No need to stress, I don't need the stress. With Accion Microfinance Bank, I tell with the best, I no settle for less. Bank where they make it life better. With shaking the money, you fit open account. Save money now to pay your bills. And you fit to get it on to grow your business. Well, my future is bright, oh. My future is bright, oh. With Accion Bank. With Accion, oh. My future is bright, oh. With Accion Bank. With Accion, oh. My future is bright, oh. With Accion Bank. With Accion, oh. My future is bright, oh. It's bright, oh.
Accion Microfinance Bank. My future is bright.
Hey, Accion, star 572 hash. Now the code Accion, star 572 hash. Money go. Open account with Accion to save for tomorrow. There's an easy way to bank every day. Hey, star 572 hash. Now hear me the code. I know get wahala. Oh, it's a life. Oh, money on me go. Family and friends and business partners on top your phone. Wherever you are, whatever you do, hey, pay your bills and recharge your
Jidini
phone.
Accion Bank kwe kugo kun. Piano star 572 ash.
Má ṣe ìyọnu láti lọ sí ilé ìfowópamọ́ ìwọ ṣáà ti tẹ star 572 hash lórí ẹ̀rọ ìbánisọ̀rọ̀ rẹ.
Accion Microfinance Bank. My future is bright.
Nítòótọ́, ṣé pé tí mo bá ṣí àkáǹtì pẹ̀lú Accion wá máa máa rọrùn fún mi.
Ina son iya karbar kudin Accion banki na yi amfani kai kara kasuwa ta.
Chai, Accion Bank kung para ni ATM card.
No need to stress, I don't need the stress. With Accion Microfinance Bank, I tell with the best, I no settle for less. Bank where they make it life better. With shaking the money, you fit open account. Save money now to pay your bills. And you fit to get it on to grow your business. Well, my future is bright, oh. My future is bright, oh. With Accion Bank. With Accion, oh. My future is bright, oh. With Accion Bank. With Accion, oh. My future is bright, oh. With Accion Bank. With Accion, oh. My future is bright, oh. It's bright, oh.
Accion Microfinance. My future is bright.
Hey, Accion, star 572 hash. Now the code Accion, star 572 hash. Money go. Open account with Accion to save for tomorrow. There's an easy way to bank every day. Hey, star 572 hash. Now hear me the code. I know get wahala. Oh, it's a life. Money on me go. 572 hash. Oh, get a life. My future is bright. 572 hash. Send money to family and friends and business partners on top your phone. Wherever you are, whatever you do, hey, pay your bills and recharge
Jidini
your phone.
Accion Bank kwe kugo kun. Piano star 572 ash.
Má ṣe ìyọnu láti lọ sí ilé ìfowópamọ́ ìwọ ṣáà ti tẹ star 572 hash lórí ẹ̀rọ ìbánisọ̀rọ̀ rẹ.
Accion Microfinance Bank. My future is bright.
Nítòótọ́, ṣé pé tí mo bá ṣí àkáǹtì pẹ̀lú Accion wá máa máa rọrùn fún mi.
Ina son iya karbar kudin Accion banki na yi amfani kai kara kasuwa ta.
Chai, Accion Bank kung para ni ATM card.
No need to stress, I don't need the stress. With Accion Microfinance Bank, I tell with the best, I no settle for less. Bank where they make it life better. better. With shaking the money, you fit open accounts. Save money now to pay your bills. And you fit to get it on to grow your business. Well, my future is bright, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. With Accion, oh. My future is bright, oh. With Accion, oh. My future is bright, oh.
Accion Microfinance Bank. My future is bright.
Hey, Accion, star 572 hash. Now the code Accion, star 572 hash. Money go. Open accounts with Accion to save for tomorrow. There's an easy way to bank every day. Hey, star 572 hash. Now here we go. I know get wahala. Oh, it's a life. Oh, money on the go. Star 572 hash. Oh, get a life. Oh, my future is bright. Star 572 hash. Send money to family and friends and business partners on top your phone. Wherever you are, whatever you do, hey, pay your bills and recharge
Jiri ni
your
Accion
phone.
Bank we kugo phone. Piano star 572 ash.
Má ṣe ìyọnu láti lọ sí ilé ìfowópamọ́ ìwọ ṣáà ti tẹ star 572 hash lórí ẹ̀rọ ìbánisọ̀rọ̀ rẹ.
Accion Microfinance Bank. My future is bright.
Ní tòótọ́, ṣé pé tí mo bá ṣí àkáǹtì pẹ̀lú Accion wá máa máyé rọrùn fún mi?
Ina son iya karɓar kuɗin Accion banki na yi amfani kai ƙara kasuwa ta.
Chai, Accion Bank nwere ni ATM card.
No need to stress, I don't need the stress. With Accion Microfinance Bank, I deal with the best, I no settle for less. Bank where they make it life better. With shaking the money.